So, you've had surgery. The hard part is over, right? Well, not exactly. The surgery was a crucial fix, but the real work starts now. Think of your surgeon as the expert mechanic who replaced a faulty part in your car. Now, it's up to you and your physical therapist, your driving instructors, to learn how to use that new part safely and effectively. This is where post-operative protocols come in. They are not just suggestions. They are a carefully designed roadmap. This map guides your recovery journey, ensuring you reach your destination, a strong, functional, and pain-free life, without taking wrong turns that could lead to setbacks or even damage. A post-op protocol is essentially a playbook created by surgeons and physical therapists based on years of research and clinical experience. It tells us what to do, when to do it, and, just as importantly, what not to do. Following this guide protects the repair while rebuilding strength and mobility, one safe, calculated step at a time, getting you back to what you love. A total knee arthroplasty, or TKA, is like getting a brand new hinge for a very important door. The primary goal right after surgery is simple: manage swelling and start moving. In the first few weeks, phase 1, 0 to 4 weeks, the focus is on gentle range of motion and waking up the muscles around the knee, especially the quadriceps. A common mistake is thinking rest means no movement at all. We want you up and walking with a walker or crutches the same day as your surgery. Key exercises include ankle pumps to prevent blood clots, heel slides to improve bending, and quad sets to get your thigh muscle firing again. The goal is full straightening, or extension, and about 90 degrees of bend. As you move into phase 2, weeks 4 to 8, the game changes. You're likely walking with less support, maybe just a single cane. Now we build strength and improve your walking pattern. Your therapist will introduce more challenging exercises. Think mini squats, stationary cycling with low resistance, and step-ups. We still protect the joint. High-impact running and jumping are off limits. Focus on endurance and functional strength, rising from a chair and climbing stairs confidently. Bending goals increase to around 110 to 120 degrees. Phase 3, 8 to 12 weeks, is where you feel more like your old self. We advance strengthening and tailor to your life, adding resistance bands or light weights. Most people ditch the cane and walk with a normal gait. Targets: minimal pain, good strength, and functional range for daily activities. From 3 months on, fine-tune for recreation. While marathons are out, golf, swimming, cycling, and doubles tennis are in. Personalize your goals and keep up your program. It protects your investment. Recovering from a total hip arthroplasty, or THA, is often a bit quicker than a knee replacement, but it comes with its own rules. The most important rules are your hip precautions. These depend on the surgical approach, posterior or anterior. For a posterior approach, don't bend past 90 degrees, don't cross your legs, and don't turn your foot inward. These are critical in the first 6 to 8 weeks to prevent dislocation. Early therapy focuses on safe movement, getting in and out of bed, using an elevated toilet seat, and walking with a walker while respecting the rules. Phase 1, manage pain and swelling, walk safely, and begin gentle muscle activation. Learn to dress with long-handled tools to avoid breaking the 90-degree rule. It feels awkward, but it protects the surgeon's work. Phase 2, graduate to a cane, build strength and expand exercises as precautions lift with surgeon approval. Eliminate a limp and build endurance for longer walks. Recovering from a rotator cuff repair is a marathon, not a sprint. For the first 4 to 6 weeks, your arm lives in a sling, positioned away from your body, with zero active movement. Lifting could tear delicate sutures. Think of it like a baby bird. The tissue is fragile and needs time to heal. Your therapist performs passive range of motion, moving your arm for you. Your job: manage pain, reduce swelling, and keep the hand, wrist, and elbow from getting stiff. Around 6 weeks, phase 2, a big milestone, you can assist the arm with pulleys or your good arm. Table slides restore motion gradually and pain-free. Still no resistance heavier than a cup of coffee. Patience is key. Phase 3, around 12 weeks, begin cautious strengthening. Light weights, bands, and scapular control for a solid foundation. Exercises like rows and scapular clocks precede gentle rotator cuff work with isometrics. Phase 4. Tailors to goals, dynamic and sport-specific, but returning too soon risks setbacks. Anterior cruciate ligament, or ACL, reconstruction is a journey of patience and precision, especially for athletes eager to return. Phase 1. Goals. Get swelling down, regain full knee extension, and start gentle bending. Perfect extension prevents a limp. You'll use crutches with surgeon-allowed weight bearing. Key early exercises: quad sets, heel props, and gentle heel slides. Phase 2. Off crutches, rebuild the quadriceps that tends to shut down. Progress from double to single leg patterns, add stationary bike, leg press, and hamstring curls. Balance and proprioception retrain, brain joint control to prevent re-injury. Around 3 to 6 months, if criteria are met, begin controlled jogging and agility like side shuffles and karaoke with perfect form. Emphasis on jump landing mechanics and avoiding knee valgus. Return to sport at 6 to 12 months or longer is criteria-based. Strength symmetry and hop jump tests with perfect control. Only then do you gradually return. It's about being game ready, not just feeling good. A common pitfall is the too much too soon mentality. Feeling better isn't clearance. Pain is a late indicator of overload. By the time it hurts, you may have stressed the repair and set yourself back. On the flip side, fear causes guarding. Avoiding knee bend can lead to excessive scar tissue and stiffness. PT should be challenging and sometimes uncomfortable, not injurious. No discomfort, no progress is often true. Protocols guide, but aren't unbreakable laws. Listen to your body's signals. On swollen, sore days, scale back. Use ice, elevation, and gentler movements. Communicate changes to your therapist. Stopping after formal PT leads to gradual decline. Make exercises a permanent habit, like brushing your teeth. Ongoing glute work protects gait and implants. Consistency wins the long game. The success of your post-operative journey hinges on communication. Your team, surgeon, physical therapist, and you, the most important player. For this team to win, information must flow freely and honestly. Speak up if something feels off or unclear, and be specific when describing pain. Is it sharp, dull, achy, or burning? Where is it? What activities make it better or worse? I get sharp pain in the front of my knee going downstairs, but not on flat ground. Helps your PT pinpoint and adjust. Be honest about your home program. Accurate data, not judgment, drive solutions. Come to follow-ups prepared. My knee swelling increases after the bike. Is that normal? When can I be cleared to drive? This partnership aligns surgical and rehab care. Take ownership. Be the project manager of your health. Follow the protocol, listen to your body, do the work, and celebrate small wins. That's how you unlock your surgery's full potential.